Alright, so I'm going to try to go through this as fast as possible. This is where your login info and password will go. Alright, so here you'll see clinic dates and which office. You should see your name here. So we're gonna go with this test provider. You'll click patient list to go to your patients. Right now there's only one just because this is a test clinic. So show the time, patient name, any special notes. You will not see this button. This button, the CE packet, that's where you'll have all of the patient documents. In here, you have to click multiple things, the different documents here. It'll all be in one. It'll start with the request form. And if you keep on scrolling, you'll see any additional records, such as the background and support docs. Then, something I do want to say about this, if a patient, before the appointment date, canceled, and it's no longer coming in that day, their name will still show. So we will most likely send you guys a list of the actual schedule, just so you guys are aware, hopefully the day before. So then now you click here to go to the note. Everything here is either click or drop down. I'm gonna start here. Click or drop down. See, for example, you drop down here, and then you'll click whatever is correct. Sometimes if you click something, it'll expand and ask more questions about it. For example, later on over here, we'll see if you click on hypertension or diabetes or something like that, it'll expand. Here's the chief complaint. This will auto-populate in the assessment later on. And may fill out social history. Like here, if you click on diabetes, it's gonna ask you, is the patient on the medication? Do they actually take it? How many years diagnosed? Sorry, that's my bird chirping. Please fill out everything to the best of your ability. If there's nothing, then you'll just press no and it'll close things up, which I'll show you later on. So here, you press no pulmonary disease, so it blocks everything out. No history, it'll take it away. Most of the time they have something, at least one thing here. And then here you just put any details. Of course, it doesn't have to be super extremely descriptive, but any details that are important, I'm sure you guys will know or will decide correctly on when to put what. So everything we just click and go. The MA will fill out some things. These detailed history. Still debating if the MA will do it or not, just because it asks about specific conditions, and sometimes the patients don't even know what they have. And then I'd rather not have the MA put something incorrectly, since and have you guys, since you guys know more, then it makes more sense that you guys will know better at that. This will be done by the MA. College, job, can you dress yourself, can you drive. Here they ask for specific details, so of course if you guys want to review it, you guys can review it as well. MA will do past medical history, so this is hospitalizations, ER surgeries, hospitalizations, ER visit surgeries. Review systems, any of the conditions mentioned in the history automatically populate here. And of course, you can add anything according to your liking. I believe we'll also leave this for the providers as well, because it asks about look like asthma, COPD, all that. I don't really feel comfortable with the MA putting for sure a disease, just because this will actually go in the report later on. So yeah. Because sometimes the request form shows exact disease that they already have, but sometimes they tell you something, and because they don't even know exactly what disease it is, I just don't want it to mess up your note. Vitals will automatically populate from where the MA types it. See here, description. There's a few places where it'll ask you these same questions. Do they have difficulty ambulating? And do they use a device? So I know there's at least one more place. I'll try to point it out later on. So yeah. So this is a physical exam. Some things you click, it asks to expand. I didn't click everything out here just because I wanted to save some time. So I'm just gonna click through range of motion. This is kind of nice because it starts off as blank, and I know in Hino we have everything as normal. So here starts off as everything blank. You just click here. It'll automatically make everything normal within normal limits. See, here are the normal ranges. If you want to change, say the lumbar, it wasn't 90, it was 45. Let's say you just do that, and then you fill in the rest. And then the box on the right is for joint deformity. So if you notice they have joint deformity, then you click yes. See, joint deformity. Enlargement, crevitus, tenderness. If yes, explain for a complete comment, see report. To pay yes, and then whatever details you think are correct for there. You can always press save, but it'll keep you on the same window. Or you can just click the arrow. Now, I did want to bring this up. I know lately we've been getting a lot of messages from Social Security specifically about hand joints and movements and dexterity. Well, here we go. This should reduce them calling us back and me having to bother you to recheck a note. So yeah, that's good. Click onto the right will also should be saving the note as well. This we don't really do any, we don't order or perform any of these right now. Later we may do PFTs. I think that's our next thing to do, but that won't affect everyone. So right now, don't even worry about it. Okay, so this is where the chief complaints auto-populate. You can edit it here. If you don't want it to say low back pain, you want it to say lumbar degeneration or whatever you think is best, you can edit it here. This is where your plan will go. I put a dash here and not here just so that you can see how it looks later. If you don't put a dash, it'll just look like a continuous sentence. It'll say like asthma followed with PCP. If you put a dash or something, then it'll show a little bit of separation. It's up to you. These are the limitations, what they're limited and not limited. In the beginning, it'll look like this. If you put no limitations, something will come up. If you put their limitations with whatever, it'll expand. You'll click whatever they think they have limitations on, and then I'm sure you guys already know this, but just in case, this is like their guidance of what they use, and then you just put specific. All these drop downs and clickings, it's so that you don't have to type a complete the whole sentence. The report, the system will put together the report depending on what you clicked and drop down and the little details that you wrote. Class limitations with whatever you think here, and then details. Okay. And then here's that ambulation thing again. We just want to remain consistent, because then they'll call and be like, well, you weren't consistent. And then we don't like that. So see here, I didn't click on everything throughout the note, so it's not looking exactly how it would look if we filled it out completely, but it puts it all kind of in a story, which is nice. If in the ROS you put normal, they'll make it seem like there was nothing, which is the point, vitals, maneuvers. I just clicked that the patient had this moderately Parkinsonian, and this is some details that I wrote, so it shows. And then yeah, so everything comes out like a sentence, mostly sentence format. This is where the assessment and plan was. You see, this is where I put the dash at. This is with no dash. I mean, the good thing about this window is that you can come in and type whatever you want. You can backspace, take something out, add something in. So if you don't want to put the dash before, but here you'd rather do this, like, feel free, whatever you think is best. And then here's the limitations area. Yeah. So now to sign the note, of course, we ask that you please review this. I know we don't have the time to read every single word on this, so maybe at least a skim just to make sure everything is good to your liking. And then when you're ready to sign, you click sign report. And then now it's done. So if you click on it, it won't let me type now. And then if for whatever reason you have to either update the note, you can do two things. You can either update or do the addendum. Addendum, you can type here, press sign report when you're done. If you want to actually do it in the note, clear signature. You now have access to type, update it however you like, and then you sign it again. I always click save just out of habit, and then you can go back to the schedule. This will be where your patient list is for that day. See, now it's gray, that means it's signed. So if it's blue, so that you know it's still open. Once it's gray, it's signed. Okay. If you want to edit it, if for whatever reason you have to go back and edit, you just click on it. Even if it's gray, you can click on it. I suggest going to the report tab and just updating it on here, on this. You would have to do clear signature, edit, and then sign again, or addendum and then sign report, whatever you prefer. And then that's it. Just like that right here, and then you log out. For forms, we're not 100% sure what we're going to do yet. There isn't really a way to upload it yet onto this system, so there's a chance we will be doing those on paper, and then I'll just fax it with the report. But so that's most likely what we're gonna do right now. If anything changes, I'll definitely let you know. Let me know if anything. Thank you. Bye bye.